Dr. William Knight, A. Knight IV, is a professor in the Department of Emergency Medicine at the University of Cincinnati College of Medicine. Dr. Knight is also the lead physician for the Cincinnati team of unaffiliated neurotrauma consultants, visiting team medical liaisons, and emergency medical services support, including on-field paramedics, airway management physicians, and respiratory therapists. Dr. Timothy Pritz is a trauma surgeon and serves as a professor in the Department of Surgery at the University of Cincinnati College of Medicine and the Division Chief of General Surgery. I'm going to hand our beginning comments over to Dr. Pritz so he can begin to share the current medical condition of Damar Hamlin.
All right, let's get into this update.
Dr. Pritz?
Good afternoon, everybody, and greetings from the University of Cincinnati Medical Center. It's our privilege today to meet with you. And Dr. Knight and I are representing the many individuals and teams that have helped care for Mr. Hamlin since the on-field event on Monday night. We would like to share that there has been substantial improvement in his condition over the past 24 hours. We had significant concern about him after the injury and after the event that happened on the field, but he is making substantial progress. As of this morning, he is beginning to awaken, and it appears that his neurological condition and function is intact. We were very
That's a very good
proud
sign.
to report that. Very happy for him and for his family and for the Buffalo Bills organization that he is making improvement. He continues to be critically
I imagine
ill,
at this point they
continues to
definitely did some sort of CT scan of the brain and trying to determine if there's any anoxic brain injury, and I would imagine nothing significant was shown if this is the statement that they're making, so that's great.
undergo intensive care in our surgical and trauma ICU. He's being cared for by ICU, neurocritical care teams, trauma surgery, and a cardiology team, as well as our expert nurses and respiratory therapists. They are attending to him, and he still has significant progress that he needs to make, but this marks a really good turning point in his ongoing care.
Wow, this sounds really positive.
We are happy to entertain some questions, and I believe representatives from the Buffalo Bills are going to help facilitate those for us.
31 questions in the chat.
Yeah, we can't see the chat, but
Dr. Prince and Dr. Knight, we really appreciate
Cameron Wolf will be first.
Dr. Prince, Dr. Knight, this is Cameron Wolf with NFL Network. We really appreciate you spending some time with us and sharing some updates here. If possible, can you take us through the timeline from when Damar arrived in your care to where we are now, as far as what you guys did with his recovery and where that progress in specific is?
do that with the person who just posed the last question.
Did that come through clearly there?
No, can you try again?
Yes, apologies. First of all, appreciate you, Dr. Pritz and Dr. Knight, for your time and your care in this situation. This is Cameron Wolf with NFL Network. Just wanted to inquire if you can take us through the timeline from when Damar came into your care and to where he is now, as far as what you guys have done to get him to this significant improvement stage.
Sure. And thanks for being here today. What I can tell you is that our team involved a significant number of the care team involved in helping with Mr. Hamlin on the field on Monday night. He was attended to by 4 of our emergency physicians serving in the various roles as the airway physician, the visiting team medical liaison, a neurotrauma consultant, as well as one of the team physicians for the Cincinnati Bengals. As everybody knows, Mr. Hamlin suffered a cardiac arrest on the field, and it was promptly recognized by the Buffalo Bills medical staff, and that allowed for a very immediate resuscitation on the field.
Yeah,
He
that's
was
huge,
promptly
being able to
resuscitated.
resuscitate
It did
extremely
require
fast.
CPR and defibrillation, and at which point he was transported to the University of Cincinnati Medical Center, where he was met by Dr. Pritz and the trauma team, as well as our emergency medicine colleagues. He was managed and resuscitated and worked up in the emergency department, had some additional tests in the ED and in the hospital, and then has been managed in the surgical ICU, as Dr. Pritz said. It's been a long and difficult road for the last 3 days. He has been very sick and has made a fairly remarkable recovery and improvement to the point, as Tim noted, he is now demonstrating that sign of good neurologic recovery,
Wow,
as well as
again,
overall clinical
really important.
as has been previously reported, related to not just his vital signs, but a lot of his other individual organ recovery.
Yeah, this is really positive news. This is not
Doctor,
always the case
this is
with
Thad
people that go
Brown
into
from
cardiac
WRLC
arrest.
Television in Rochester, New York. Again, like Cameron said, thank you very much for your time and all the work that you've done with this. Can you speak at all to the cause of what happened? What caused the cardiac arrest? And I think specifically, was it simply the actions that happened on the field, or was there something existing
I'm sure they're
that,
not going to give
made Mr. Hamlin
a full answer to this. I mean, it makes sense that it'd be commotio cordis, but
the answer
you
to
never
that
know
is
if there's an
that
underlying
that workup
condition
is
either.
ongoing. We do not have definitive answers as to the etiology of the arrest at this time, and that tests will continue to be ongoing as he continues to progress.
Thank you very much.
Hi, Dr. Knight and Dr. Pritz. This is Matt Bove with WKBW in Buffalo, New York. As everybody has also said, thank you for everything that you guys have done. I know you briefly mentioned it to Cameron's question about what the timeline was like, but can you guys go into a little bit more detail or explain how critical those first moments were on the field to ultimately get him to this point, and what the doctors and the medical staff from the Bills and Bengals were able to accomplish in that period?
Sure. I think it just speaks really to the immediate recognition that there was something significantly and seriously wrong by the Bills medical staff. Team and I speak together. We cannot credit their team enough. They're often,
That's great.
unfortunately, there are injuries occasionally that happen on sports fields, be it football or others. But it is incredibly rare to have something be this serious that happens like that, and to be that quickly recognized. What they did was immediately marshal the emergency action plan, meaning the emergency medicine services. That prompted the airway physician, the emergency physician that was out on the field, to be at his bedside in less than a minute. He had a prompt.
That's very fast. That's awesome. I wonder if it was actually an emergency physician, like an ER doctor, or do they have sports medicine doctors covering, or maybe both? And the fact that they got an airway on him so fast, meaning someone was there who was knowledgeable enough and had the skills to intubate quickly and then get him over to the hospital. I mean, if this didn't happen so publicly in a general where you had immediate medical attention, I mean, this could have been a completely different situation. But it sounds like, honestly, things are going in the right direction. So that's really great to see.
Loss of pulse, which gave him immediate bystander CPR, which, as many of you know, rarely if ever happens. And so the fact that Mr. Hamlin had immediate bystander CPR, in addition to prompt recognition of his arrhythmia, to get defibrillated and then back to the return of circulation very quickly, that speaks to that timeline that you were asking about, to get the return of spontaneous circulation with immediate bystander CPR that was performed.
We call that ROSC,
well,
time to ROSC.
All meeting the standard of what we would expect in that scenario is what has led us to be able to discuss these good outcomes today.
I will second that. You know, the Bills training staff who was with him immediately recognized that this was not a run-of-the-mill injury and that they had a significant event on their hands, and immediately responded and got the emergency response team involved in his care. And really, this went as well as something like this could go under very challenging circumstances. And they did a fantastic job, which is why we're here today.
And understanding how complicated of a situation this ultimately is, would it be fair to say that if things would have taken a few extra minutes or maybe even a few extra seconds, there could have been a different outcome here?
I think that's fair to say.
Yeah, because I mean, so if you for example, if let's say no one got there for the first 6 minutes and his heart was not beating for 6 minutes, that's 6 more minutes that he's not getting oxygen to his brain, which can make a dramatic difference in the overall outcome because the brain is so sensitive to oxygen. So other organs, if they're not getting oxygen for a period of time, they can recover a lot better than the brain. So the biggest problem, or one of the biggest problems when you go into cardiac arrest, is the heart's not pumping, blood's not getting to your brain, and it's the anoxic brain injury that ends up usually being the reason for someone to have very poor outcomes. So the fact that they got the CPR very quickly, were able to perfuse the brain as best they can, and shock his heart back into a rhythm to regain a pulse in the time that they did, definitely made a huge, huge difference.
For everything that you guys have done and for the time today.
This is John Scott from Spectrum News in Buffalo. You mentioned there are signs of neurological intact. What have been those signs that you have seen from him that give you the reasoning to make that assessment?
Well, we were in the situation where we wanted to allow him to gradually, wake up as the rest of his body was healing. And last night he was able to emerge and follow commands and even ask who had won the game.
And
it's a true athlete right there.
I'm sure you don't necessarily deal with these events regularly, but how common is it from Monday night to now for that sort of improvement to be made?
The answer to that is it's variable. We do manage post-cardiac arrest patients routinely as part of critical care in all of our ICUs, and it's variable, but it speaks to his age, his incredible fitness, and then again, I don't think that we could emphasize enough the immediate medical response. The fact that he had highly trained professionals from the Buffalo Bills, in addition to having paramedics, emergency physicians, respiratory therapists, all right at his bedside in less than a minute from the collapse, that speaks to that ability that demonstrates that he had good perfusion to his brain that led to no identifiable neurologic deficit.
Thank you so
That's
much.
awesome that he's saying that.
Dr.
And yeah, it really
Prince, I
takes
just
an
wanna
insanely
follow up on
large
something you
team,
said
and everyone has to be
that
in proper coordination
spoke
together.
last night. Can you speak to that?
I can clarify. He did not speak. He was able to communicate in writing, and he is unable to speak with us yet, as he still has a breathing tube in, and we're still assisting him with ventilation. So when he was communicating with us last night and then again today, that's been in writing.
That's still good that he was aware enough to be able to write who won the game.
One of our partners, when he asked, "Did we win?" The answer is yes. Damar, you won. You've won the game of life, and that's probably the most important thing out of this. And we really need to keep him at the center of everything else.
Oh, I just got goosebumps from that.
We really want to ensure a good outcome for him.
Hi, this is Todd Nikes with WLWT TV here in Cincinnati. And doctors, again, I know so many people are just so grateful for the work that you've done, the work on the field and so forth. I was fascinated, I think so many of us were, to learn about the protocols the NFL has in place, the 60-minute meeting and so forth, when the chief medical officer talked about that yesterday. And the question was asked a bit earlier, but I'll circle back. Had there not been one thing in that protocol that would not have been in place, whether it was equipment or might not have worked, or a personnel or so forth, what would that one thing have been that could have led to a more, tragic outcome? Because I think we're all realizing that the NFL does a lot of pre-planning for these kinds of situations. I'm just curious to get your take on that.
I'm not sure there is one thing. I think that really speaking and emphasizing to that team approach, that if you see those pictures in that video of the congregation of the team, you had Bills professionals, Bengals professionals, independent physicians, but we have all the right equipment. There's all the EMS equipment, airway equipment, advanced cardiac life support equipment, the ability to do CPR, the ability to defibrillate is all there and all spelled out in terms of accessibility. Speaking specifically to our team, we had several of my partners that were teammates, that were partners, that were helping to resuscitate Mr. Hamlin. And you have those scenarios where people know each other and they train together. There's not a lot of speaking that needs to happen. They know how to work. They know how to integrate, no different than when Dr. Pritz and I are working in the trauma bay that you see. And that really goes a long way to helping with that in terms of that overall management. But was there one thing, or is there one thing that, if absent, would have led to a poor outcome? I can't say that there was any one thing, because it really is the entire global spectrum of care from the minute he collapsed until the ongoing care he's receiving right now up in the ICU.
Thank you.
Hi, this is Catherine Fitzgerald from the Buffalo News. Thank you guys so much for all of this clarity and everything you're doing. I was wondering if you could just add a bit more context on kind of what next steps will look like for recovery from Damar. You know, you mentioned how his health puts him in a good position, but just from a human
it's still going to be a long road to recovery,
what is the
but
process like from here?
Clearly he's moving in the exact right direction you'd want to see.
That's a great question. And there are many, many steps still ahead of him. From our standpoint, we would like to see him continue to improve, to be completely breathing on his own, and then to be, ready to be discharged from the hospital. So those are the immediate next steps as we go for his care. His family has been with him at his bedside.
Usually if he's at the ICU, you go from ICU to a step-down unit or back to the floor, so he's not going to go usually from ICU right out of the hospital, though.
And so those will be the immediate next steps, and then we'll talk about.
And of course, they need to try a trial of extubation to make sure he's not on the breathing tube.
Hey guys, it's Liz Bonus from WKRC TV Cincinnati. So excited to just talk to you for the first time, and I want to say you've certainly made a difference showcasing our city and the great medical care here. A couple things. I've heard that he had to be trached on the field. I was wondering if you could comment on that.
He was definitely not trached on the. I don't think he was trached on the field.
And then I also just wondered, kind of from here, what about the physical constraints now? Do you expect him to fully walk and talk and all the rest of that? Sounds like the brain function we were really worried about is good, but what about the rest?
Liz, I can answer your first question. He was not trached on the field. He was intubated on the field, had a what I would deem a textbook resuscitation on the field from, again, immediate bystander CPR, defibrillation, airway management, and then transport to the hospital. It's critical that we do that resuscitation at the scene of where a cardiac arrest is. That portends the best recovery. There was no trach or airway other than the endotracheal tube that he has.
Yeah, that wouldn't make sense.
As for the long-term recovery, again, we're focused on the right now.
Unless
he still has a little ways to go in terms of liberation from the ventilator, and I think that's going to be our focus right now in terms of helping him to recover, liberate, continue to get stronger, and rehabilitate. But it is entirely too early.
Yeah, he'll definitely need a lot of rehab. This is where PM&R.
So is there any reason that you don't expect him to make
physical
a full
medicine
recovery?
Rehabilitation definitely will
Again,
come into play
we're
at some
focusing
point
on right
him.
now. I don't have any reason to expect or not to expect anything into the future, just focusing on what's going on right now.
All right, last thing. Lots of people are praying for you guys, and they've just wondered if you felt it.
Yeah, we have. It's been very powerful. We've been surrounded by a great. I think we keep using the word team, in that by Dr. Pritz and I being able to get to know this amazing family and this amazing organization of, in a matter of 48 hours, having friends and having family, of the hugs and the tears that have already been shed just by the progress that's been made. But then looking outside, I mean, all I have to do is look over my left shoulder and I see vigils and posters and well-wishers, and the food that has showed up at the hospital for the support for the family and for the emergency department and for the surgical ICU team, the support that's been done to the family. Damar's family is wonderful. They've been right here. They've been great throughout the entire stay. And so have we felt it? Yeah, it doesn't take long to look outside and see the lights, the blue and the red around the city of Cincinnati, the support from local restaurants, the support from the fans and just people who are concerned. So yes, it's been very powerful.
Yeah, that the one thing, I guess if you want to call it a silver lining, that's been great is to see the support just around the country for this young man has been definitely very remarkable. Also, if you ever do want to support your healthcare workers, they love free food. So you send free food to the hospital, and I'm sure they're going to be very happy.
And does Damar know it too?
He's learning it today.
He's learning it today.
Excellent. Thanks, you guys.
Hi guys, this is Coley Harvey with ESPN, and just echoing everyone else. Really, thank you guys so much for taking this opportunity to talk to us. I actually I just have two questions, but I want to piggyback on that last point. You guys have mentioned that there has been a level of communication with Damar writing. I'm curious, what are you all able to see that he's understanding or processing what all has happened to him these last couple of days?
We've discussed, with him what happened. He's not quite at the point where we can have a conversation because, again, still has the breathing tube in and is able to communicate with yeses and nos by shaking his head, nodding his head, or with brief notes. He was expressed surprise that he had been, not with the world for 2 days. We've talked to him about all the support that's been given from Cincinnati, Buffalo, and really across the country for him and his family during this time.
I can't imagine what that's like.
His mom and
waking
dad
up
have
after
talked to him
those
about
2 days.
what has happened, and we expect that we'll continue to have ongoing conversations with him. And again, his first question that he wrote when he started to awaken was did we win? So we know that it's not only that the lights are on,
amazing.
we know that he's home, and that it appears that all the cylinders are firing within his brain, which is greatly gratifying for all of us, for the nurses and the respiratory therapists and the care team that's been at his side, for his family and for everybody else beyond.
And my last other question is, what comes next? What exactly are you all looking to see next as you begin to go forward with his recovery?
Yeah, well, we want to see him continue to breathe more on his own, and then we want to get him breathing completely on his own. That'll be the next big milestone for him.
Thank you guys so much.
Hello, doctors. Adam Kilgore with the Washington Post. Thank you for doing this. At this stage, what would you project to be the best case scenario for Damar's ultimate return to function?
I think,
It's hard to speculate
what is the best? The best is getting him to the way he was at 8 o'clock on Monday evening. Is completely neurologically intact, strong, good lung function, no cardiac dysfunction with his heart. The best outcome would be back to who he was before this all happened.
It sounds like so far he's doing as good as he possibly could have in this situation.
Hi, this is Jacqueline Howard from CNN, and thank you so much for taking my question, and thanks for all of the work that you guys are doing. I do have some questions about just the chain of events and what happened. We're curious, did he have a second resuscitation at the hospital? And then how long was the defibrillator used and the total minutes of CPR? And lastly, can you confirm, is he moving his hands and feet at this time? Thank you.
I'll start in reverse. He's moving his hands and feet, and again appears to be neurologically intact to both our exam and our neurology consultants exams. So it appears to be doing well. He received one defibrillation and one round of CPR that was on the field. He did not receive a second defibrillation or additional CPR once he was in the ambulance or at the hospital.
Hey, doctors. Thank you for doing this. To clarify something that was just said, the best is getting him back to the way he was prior to the injury. Does that mean the door is open for him to play professional football again? And then in the more immediate term, what's a reasonable amount of time to suspect that he will remain in intensive care and in the hospital as a whole?
I think the answer to the first question about his future in professional football is that it's entirely too early to have that conversation. He's still critically ill in the ICU. Our focus is on getting him better, to get him extubated and on the road to recovery. So it truly is too early to have that conversation. I already forgot your second question. I apologize.
The real next steps are allowing him to continue to get better. Again, we're still focused on the day-to-day.
Yeah, it's going to be really hard to tell. It sounds like it's within the realm of possibility, which is rare to begin with, and it sounds like almost a miraculous.
This is Tom Puckett
the
from
positive signs he's
WBEN
showing so
News
far.
Radio
We do see this
in Buffalo.
but it could vary, and most people, I mean, like the stats show less than 10% of people get CPR outside of the hospital. So if you're just someone on the street and randomly drop down with a cardiac arrest, it's less than 10% chance of survival in some studies. And this is a different situation because he's young, he's healthy. They got to him right away, like within minutes to seconds. And so that makes a big difference, but it's still, this is very, very positive news that I was honestly unsure of which way it was going to go.
Doctors, I know you just answered Chris's question about the time frame for Damar Hamlin's return for the pro football, but how much post-hospitalization physical therapy and the likes will he need before he gets clearance to return to football?
Yeah, that's a very good question. And it's really individualized to each person. And that process of recovery, rehabilitation starts to really engage and involve physical therapists, rehab physicians in terms of what are his
rehab
needs.
Physician.
He was incredibly sick for 2 days in the ICU, and we would expect that as he continues to recover, we'll see what kind of sequelae there may or may not be from that. A lot of it is just going to be defining what kind of strength may he have from that and recover as we get his nutrition back up to par and his strength back up to par and his rehab and recovery. So it'll be a very individualized, tailored plan that'll become a lot more clear when we're in that phase, which we're still a little ways out.
They still have to extubate him and make sure that goes well. So.
Hello to you both, and thank you, as all of us have been saying, so much for taking some time to be here with us today. This is Jenna Harner from WPXI in Pittsburgh. You mentioned liberation from the ventilator. What hurdles are still left for Damar to get off that ventilator and hopefully, as I know a lot of us are hoping, to have him get out of the intensive care unit?
You know, we sort of view the ventilator as an aid for him as he needs it. And so, you know, after the initial event, we were supporting him on the ventilator 100%. And what our goal really is for liberation from mechanical ventilation is to gradually decrease the amount of support and let him pick up the difference. And when we, you know, reach 0% support, breathing tube comes out, and then we define that as success.
Yeah, the way ventilators work, and I'm not an expert, but I actually recently did an ICU month. Like, you're basically, even though the ventilator's supporting, it can tell if the person is trying to breathe on their own. And so you see how much they're able to actually breathe on their own, and you wean down the support. And then ultimately, once it seems like that they might be able to fully breathe on their own, you have a trial of extubation, and you try to take them completely off the ventilator.
Hi, this is Maura Hellman with Today. Thank you again so much for taking the time. There's been a lot of speculation around the fact that Damar's condition might be related to a condition called commotio cordis. I just wanted to see if you guys had any thoughts on that. I know it's a little early to tell at this stage based about the etiology, but if you had any thoughts on whether that might be playing a role, and if so, how that may affect the recovery process. Thank you.
For sure. We've similarly heard those same suggestions. And the way that I would answer that question is that condition, commotio cordis, is an incredibly rare event that happens. It's also a diagnosis of exclusion in our world, which basically means we have to rule out many other more common or more deadly or more fixable type conditions before we can settle in on an ultimate diagnosis such as that. And so he has ongoing testing. There'll be tests in the future. And so I guess it would summarize down to it is still too early to say that. Is it on the list of considerations? It is, but he has many other things that we need to work through before a final etiology or cause for this arrest can be definitively defined.
Yeah, it makes sense for his doctors to not, especially when you're talking publicly and to the news, to not make speculation that it's definitely one thing. The commotio cordis diagnosis, it isn't diagnosis of exclusion, right? So you have to make sure that there's no other cardiac conditions. Potentially he had hypertrophic cardiomyopathy or things like that that could cause a sudden cardiac arrhythmia or have someone go into cardiac arrest. Now, most of these football players, they've gone through physicals. I don't know if they've ever gotten echoes on the heart before, but usually at this stage you would find out if they have something, but that's not always the case. And so it seems like here they want to do a full workup. They're going to have to do a number of tests. I'm sure they're doing tests now before they would even definitively say that. And then for a lot of people, you can never definitively say what caused the cardiac arrest. So it is a good theory. I made a video on it as well, but it makes sense that they're not going to state that definitively in this press conference. All right, I'm going to end it there. I don't have time to watch the rest. Maybe I'll come on live stream later and finish it out. It's great to see that Damar is doing well. I mean, it honestly seems like this is the best possible news that we could have heard at this point. So I'm super happy to hear that. I hope these updates were helpful, and I'll see you in the next video.